Too many men assume that the danger starts when they cannot pass their urine, they cannot pee at all. That is too late. Long before a man ends up in retention, catheterized, leaking, or desperate for relief, the bladder may already be changing. It may be thickening, straining, overreacting, losing compliance, or slowly giving up reserve. The real question is not just how bad are your symptoms? It is how much time does your bladder have left before the damage is not fully reversible? That is what this episode is about, the window of curability. Welcome to BPH 360, where bladder health matters. I'm Dr. Kuang, Cleveland Clinic trained urologist. BPH is not just prostate enlargement. It's about protecting your bladder. Learn to ask better questions, take control. For education only, not medical advice. For your care, consult your doctor. You can outlast your symptoms for a while, but that does not mean your bladder is safe. What is the window of curability? The phrase sounds technical, but the idea is actually very simple. Remember, we talked about in previous episodes that BPH is really about prostatic bladder obstruction. Remember, we talked about how the prostate's like a donut. As that prostate gets bigger, the donut hole is going to get tighter, restricting the flow through that donut hole. And as a result, the bladder, which is the muscle that sits behind that prostate, has to work harder to squeeze urine through that donut hole. There is usually a period of time when the bladder is going to be stressed, bothered, and struggling as it's trying to push that urine through that donut hole for 5 years, 10 years, 15 years, 20 years, but it is still capable of meaningful recovery if the underlying problem is addressed. In this situation, it's that donut hole getting too tight. If we can take care of problem one, this donut hole getting tight, it will allow now the bladder to be able to breathe a little easier and struggle a little less. That period of time where it can still have meaningful recovery is the window of curability. And it's not a cure in a magical sense. It's not a cure in the guarantee sense, but a cure in a practical sense that the bladder still has a fair chance to recover function, to calm down, and to avoid sliding into later stage damage. Think of it like bending a paperclip. At first, it bends and springs back to its normal shape. Bend it more times, and eventually it starts to not be able to recover fully back to its form and function. And if you keep going, if you keep stressing and bending, eventually on the far right, you can see here, you can actually break that paperclip, and it is irreversible at that point. The bladder is more sophisticated than a paperclip, obviously, but the principle still holds. A hard-working bladder can compensate for years. Compensation is impressive, but it is not infinite. That is where men get fooled. Remember, the bladder, this non-transplantable, amazing organ with all its muscle, nerves, blood vessel, and coordination with your brain and your spinal cord, is such a remarkable organ that it can hide trouble for a very long time. Too many men are too good at adjusting to these symptoms. Men will map out where all the toilets are. Men will stop drinking. Men will accept getting up 3-4 times at night to pass their urine. Men will start buying that aisle seat on the airplane to make sure they have quick access to the bathroom so that they do not have an accident. Too many men are saying, hey, I'm fine. This is just part of getting older. I'm tough and I can just push through this problem. But managing may be just adapting to the eventual decline in the health of their bladder and in the quality of their lives. The window of curability is the stretch of time before adaptation becomes injury and before injury becomes something that the bladder can no longer fix or repair. This is why the timing of an evaluation matters. Not every man with urinary symptoms is in danger today. But too many men are probably closer to the edge and they don't even realize it. The window of curability is that time frame within which the bladder can still recover if the real problem is identified, characterized, and addressed early enough. Quick pause because this matters. This channel is built around one idea. Better bladder health starts with better data for better decision making. If you're a company working with diagnostics, therapeutics, or technologies that genuinely improve how we evaluate and manage and protect the bladder, there's an opportunity to become a founding partner of BPH 360, not to advertise, but to help move the standard of care forward through education. Now let's get back to the episode. Why do so many men miss this window of curability? These men miss it not because they are being careless or are not paying attention. It is because the system is training men to think too narrowly. Too many men are hearing things like, it is just your prostate, or this is normal for your age, you're just getting older, or you're doing fine, so let's just watch it, or let's try a pill, or you still got a problem? Let's take another pill, or still got a problem? Take a higher dose. Sometimes watchful waiting is reasonable. Sometimes medication is also reasonable, but the danger is when those moves become automatic and happen by default. And nobody asks the deeper question, where's the data? Where's my data about my bladder health? What's happening to the bladder while we wait? This is where the bladder is neglected. A man may have had urgency, frequency, nocturia, leakage, high residual volumes, recurrent inability to pass their urine or retention, or signs that the bladder has been under pressure struggling for way too long. But if the conversation stays stuck on prostate size or temporary symptom control, the bladder may be the one who has to keep absorbing the damage. Here is the hard truth. Symptoms and bladder damage do not move together. They do not always correlate. It's not a one-to-one correlation because, as we have learned before, this amazing non-transplantable bladder is so complex. Every man manifests the problem differently. Every man interprets his symptoms differently. Some men have miserable symptoms early and still have recoverable bladders. Some men underreport these symptoms and their bladder is already on the brink of failing. Some men are tough, stoic, that cowboy archetype that we've talked about before. They're busy, embarrassed, or used to this discomfort, and they have normalized this decline, this deterioration in their bladder health and in the quality of their lives. That is why toughness is not a diagnostic strategy. The bladder may be sending signals long before catastrophe, and we need to listen to the bladder when it's speaking to us. We've talked about this before. Urgency, frequency, getting up in the middle of the night to pass your urine, that slow flow, the dribbling, the leaking down the leg, inability to pass your urine, requiring a visit to the emergency room, repeated infections, and a worsening quality of life, despite their ability to adapt. The mistake is assuming that your bladder will always be able to bounce back later. Sometimes it does, sometimes partially, sometimes not nearly as much as you would have hoped or wished for. And once you cross that boundary into late-stage disease and dysfunction, the goal may change from restoration to damage control. That is a very different conversation. Too many men miss the window because they normalize symptoms. They adapt too well and get treated as if improving the symptoms is the only outcome that matters. To summarize, taking a look at this figure, it's all about intervening at the right time to protect the bladder within that window of curability. On the far left, we see a nice, healthy bladder, all that complex muscle layers working together to help you fill up in a normal way and then squeeze urine at the right time when it's socially acceptable through the donut hole, as we see here, of the prostate. Our goal is to find the right time to listen to the bladder when it's reporting earlier that it's having issues with urgency, frequency, slower flow as signs that the prostate donut hole may be getting too tight. That is a great time to go see your doctor to learn more and get your data to figure out when is the right time for you, your prostate, and your bladder to have something done to open up that donut hole. Because if you intervene early enough, you can maximize the chances of preserving your bladder health for this amazing organ that cannot be transplanted. Too many men are waiting for things as the damage is starting to happen over 5 years, 10 years, 15 years, 20 years. And you can see here in the middle panel, the bladder now starting to thicken and struggle. The term we use are trabeculations, and you may hear that with your urologist. And we see that prostate continuing to grow tighter in the donut hole, constricting flow. And now, potentially, if you intervene in this phase, there's a risk that there is some irreversible damage that cannot be fixed. And heaven forbid you wait way too long into this last panel, and you can see here it's simply too late because the bladder has now got to the point that it is irreversibly, permanently damaged and cannot be fixed. Just like taking that paper clip, and eventually if you keep bending it enough times, it will just simply break. We do not want you to get to that point. Listen to your bladder when it's talking to you and take that information to your urologist team and have them start collecting data, because better data will help you make better decisions so you can live the best version of your life, incontinence-free and catheter-free. So how do we protect this window before it closes? It starts with education, which is why you're here today. Now that you understand this concept of the window of curability, you understand the importance of listening to your bladder early enough so that you can get your data to help you intervene at the right time before the onset of bladder damage or before the damage is irreversible. Here are some things that you can do. First, stop asking only, can I live with these symptoms? Start asking, what are these symptoms telling me about my bladder health? Are they a wake-up call to go get help because my bladder is struggling and could be dying and needs help? This shift in thinking really matters. Second, remind yourself that timing is part of the treatment plan. Waiting is not sufficient if the bladder is declining while you are waiting. There are times when medications or monitoring symptoms is reasonable, but there are also times when more testing, more diagnostics, more data will give you more clarity so you can make better decisions about management strategies, treatment strategies for your bladder health. Third, ask better questions. The easiest one is hashtag, what about my bladder? By simply saying that question to your urologist, you can now really work together with him to engage on strategies and the data you need to protect your bladder. Other questions to answer. What objective data do we have? Are we watching safely or letting the bladder actually drift away, deteriorate under our watch? How do we get better data about the man versus prostate trifecta: prostate size, prostate shape, and detrusor function? Fourth, remember to give the warning signs more respect and attention when your bladder is talking to you, especially if you're leaking urine, if you are having issues where you feel like you're not getting enough urine out, where you are having to go to the emergency room, even simply once because you can't pass your urine at all. If you feel like your symptoms are progressing or escalating rapidly and more significantly, and things feel progressive. And fifth, remember that the whole objective here for intervening earlier is not out of fear, but it is out of preservation of this amazing bladder. To be clear, we are not trying to rush every man into a surgical procedure. We are asking you to listen to your bladder and then get the data you need to make the best decisions possible. Just like if you're having chest pain or shortness of breath, you are concerned that you might be having a heart attack, that this precious heart may be in danger, and your life may be in danger. Same principles apply. So instead of chest pain or shortness of breath, you're having urgency, frequency, getting up at night to pass urine, slow flow. Those are signs that your bladder health may be at risk. So in a similar fashion, you seek help to get your data to find out what's going on so you can make the best decisions about whether or not something needs to be done now or later on. Please do not sacrifice your bladder just because you decided to wait too long to address this issue. Too many men think doing something or getting the information somehow signifies failure. That is not the case. I would frame it differently. Sometimes intervening, getting your data earlier at the right time is really about preserving your freedom, your future options, your sleep, your confidence, decreasing your anxiety, allowing you to travel uninhibited, your ability to sit through a movie from start to end, your ability to play a full 18 holes of golf without having to find every single tree to pee behind. More importantly, your ability to avoid progressing into those later stages of disease where the bladder can no longer recover. That is the bigger win. The prostate may be part of the problem, but the bladder is the organ that is paying the price. It is the victim for the prostate that is the villain. And unlike other organs, you do not get to replace the bladder. Remember, the goal is not to panic. The goal is not to rush into a surgery. The goal is simply to listen to yourself, listen to your body, listen to your bladder speaking to you. And it's about then getting the data you need to figure out what are the best strategies to help you manage your symptoms, but more importantly, to protect your bladder, that amazing non-transplantable bladder, and understanding when waiting too long can be too costly to the quality of your life. Thanks for watching. If bladder health matters to you, watch more. Follow BPH 360 to stay ahead of your symptoms. Listen on Spotify and Apple Podcasts.